Good morning, and thank you very much for joining us. I'm here on Treaty 6 territory, and I also want to acknowledge the Métis people of Alberta who share a very deep connection with this land. I'm Sarah Hoffman, the Alberta New Democrat MLA for Edmonton-Glenora, and our Shadow Minister for Health. It's been 2 weeks since these CorruptCare allegations against the UCP government from the former AHS CEO were publicly revealed. The severity of these allegations of corruption and interference when dealing with surgical contracts in our healthcare system is a major concern for Albertans, especially for those who are still waiting for surgeries, a situation that the UCP has not even come close to dealing with. We know that our public healthcare needs investment, and when Danielle Smith was running for leader, she promised that she'd fix healthcare in 90 days. Well, she's been premier for 852, and she's only made it worse. Next week, the legislature will finally return, and the UCP will have to table a budget. Albertans deserve a meaningful investment in public health care. But what we've seen under the UCP is a desire to Americanize and privatize our healthcare system. We know that the contracts for private surgical centers will expire on April 30th, and that the UCP's CorruptCare scandal has lost taxpayers more and more money, and the UCP insiders have only gotten richer. Let's be clear. Nobody wants this privatization of our healthcare system. Too many Albertans are waiting for life-saving and life-changing surgeries. We have hospitals with operating rooms that can be used to their full capacity. So let's make it happen. We're at a critical moment in our province, and this UCP government needs to make a change. The former CEO of AHS alleged that hundreds of millions of dollars could be wasted in these contracts. While the Auditor General prepares the investigation and we continue to call for a judicial inquiry, patients need their surgeries. So here's our proposal. The UCP must increase surgeries in our public hospitals. We can still get people the surgeries they need while we get to the bottom of the CorruptCare scandal. So let's use some of the same surgical capacity model practices that we implemented when we had significant backlogs in hospitals due to how overwhelmed they were with COVID. Let's make sure that our operating rooms that are currently understaffed require more investment, and that those that are already closed be reopened. Let's pause all private surgical care contract renegotiations. Let's make sure that we have that judicial inquiry while we get to the bottom of this. And let's stop the privatization of our healthcare system now. The UCP can't be trusted to sign contracts in mental health and addictions, or continuing care privatization, or acute care or primary care services. There are just too many issues with CorruptCare scandal to be able to trust Danielle Smith with our healthcare system right now. These are a few simple steps that the government can do while they sort through the CorruptCare allegations. These are the priorities that Albertans are calling for. Get Albertans public surgeries that they need now. The UCP must get out of the way and fully cooperate with a judge-led public inquiry. People need a family doctor. Nearly 1 million Albertans don't have one. Properly staff our hospitals so patients can get the right care in the right place by the right provider. This is the job of the health minister and the premier. Their rich friends and insiders shouldn't be their priority. You should be. Thank you. I'm happy to take your questions.
Okay, we'll take some questions now. If you could please state your name and outlet before asking your question. We'll limit our questions to one and a follow-up. If you are on Zoom, if you could please use the raise hand function, and if you are calling in, please use *9.
James with the Western Standard. Thanks for taking my question. When the NDP was in power, the CBC revealed allegations of political interference at AHS by Sarah Hoffman. They said political ideology repeatedly trumped evidence-based decision-making. The AHS CEO resigned, citing micromanagement and constant interference. So I'm wondering if you think the NDP has a leg to stand on, given its own history with AHS.
I'm very proud to put my record up against Adriana LaGrange any day of the week. At the very beginning of the time when I was health minister, we were implementing a platform that we had a democratically elected mandate to implement, and that included stopping the privatization of lab and laundry services. And I know that the CEO who left on her own terms wasn't happy with that, but we had a democratically elected mandate to make sure that we protected public health care. I'm proud that I did that.
Last week, Emmanuel Prestovet, Radio Canada. Last week, the NDP criticized Danielle Smith for not speaking up, not being in Alberta, not answering to these allegations. She's going to do that today. So how do you react to that?
Yeah, it's been 2 weeks since we first heard about these CorruptCare allegations. And in that time, Danielle Smith and Adriana LaGrange have tried to duck and cover, and it hasn't worked. So I expect that today they will be asked some really tough questions by all of you, and that many Albertans are sitting at home incredibly frustrated. The first words out of Danielle Smith's mouth today should be, Adriana LaGrange, you're fired. Like, there is no coming back from what she's done and the kind of chaos that she has caused, especially over the last 2 weeks while they've tried to hide from it. And then the next sentence should probably be, and I will comply with having an independent, judge-led inquiry to make sure we get to the bottom of this. Anything short of firing Adriana LaGrange and calling for a judicial inquiry is not acceptable today. It's been 2 weeks. We deserve the truth, and Danielle Smith needs to start taking some accountability.
So you're calling for a judicial inquiry. I guess you want it to be a public inquiry.
Absolutely.
What will that do anymore that what's already been done by the AG and other people who are investigating this thing?
I believe we only have confirmation that the AG is initiating an inquiry, and I will say that we've been waiting over a year already for the Dynalife inquiry to come back, one that also was Danielle Smith pushing privatization full speed ahead. The AG has an absolute mandate to do investigations into what the AG is allowed to investigate. Judges and a full public inquiry would have a much broader scope and would ensure that all Albertans can have full confidence that a judge who needs to be impartial is leading this process, and everyone in that building, in the legislature, and anywhere that has knowledge of this should be able to come forward and speak to a judge with full confidence that they are being protected and that there is an actual desire to get to the bottom of this. Clearly, the desire has been to hide and to try to change the channel. And it's been 2 weeks since these CorruptCare allegations first were surfaced. It's time for Adriana LaGrange to be fired, and it's time for a full inquiry. We need to make sure that we stop with the corruption, that we stop with the self-interest, that we stop with Danielle Smith wanting to get her friends and insiders richer and pushing an American-style healthcare system on all of us. Albertans deserve their surgeries done in a timely fashion. These are surgeries that can save lives or make lives much, much better. And instead what we've seen is a lot of hiding, a lot of attempts to change the channel, and a lot of trying to shrug off what clearly is rotten. There is something very rotten in what's happening here, and it's about time we got to the bottom of it.
So you're calling for the minister to be fired before getting to the bottom of things. I'm wondering why that approach, as opposed to what, say, Infrastructure Minister Peter Guthrie has suggested, that's shuffle her out of the portfolio until we get to the bottom of this, until we know what happened.
And we suggested that 2 weeks ago. But for the last 2 weeks, all they've done is make excuses and attempt to change the channel. It is appalling. If the health minister were to be trusted, she would have stepped aside. She would have encouraged the premier to call a full judicial inquiry. She would have nothing to hide. But we've seen them try to hide for 2 weeks, and now here they're finally going to surface. The only acceptable thing to do at this point is to fire the minister so that we can ensure that we have somebody there who is actually going to take the health care of Albertans seriously and not care more about their own political future. It's clear that they are incompetent and reckless, and these allegations of corruption are incredibly serious.
So investigations take quite some time, but this is the first time we're hearing from the Premier and Minister in a news conference. What do you think could be answered today?
Will you fire the first question, in my opinion, all of you get to actually ask the questions, but the first question on most Albertans' minds is, will you fire Adriana LaGrange and commit to getting to the bottom of this? And that is what people deserve. We have been waiting for 2 weeks, and they are finally going to surface. We asked them to come back to the legislature so that they could be held to account in the People's House, and that we could make sure that we had as much transparency as possible and for them to answer questions. Instead, Danielle Smith hid in the United States, then she hid in Alberta, and now finally we're going to have her call a press conference in the afternoon where she's going to try to change the channel before they come back to the legislature. And the only answer Albertans deserve is, will you call a public inquiry inquiry? And will you fire Adriana LaGrange?
Hi, Morgan with Global. I'm wondering, in the lawsuit that was filed, the $1.7 million wrongful dismissal lawsuit, they mentioned the 2 surgical facilities that are now on pause. The government has told us in Red Deer and Lethbridge. Are you hoping to get more clarity or answers about from the health minister about what she's being accused of in the wrongful dismissal allegation about what happened with those chartered facilities?
I think that it's clear that we cannot trust Adriana LaGrange or Danielle Smith with the privatization of healthcare, that they've put friends and insiders ahead of the public interest. So I'm calling on there to be a halt to all privatization of healthcare, including the privatization of surgical centers. But we also can't trust them to be signing contracts around continuing care, the care of our elders or those who are in severe health decline that need to be put as the priority, not their friends' profit margins. Same with addictions and mental health services. Put a pause on any further privatization, call a judicial inquiry, make sure that we can get to the bottom of this, that the truth can be out there, and then we'll see who we trust to run the healthcare system.
And Alberta Health Services did put a pause on renewing or renegotiating any of the contracts of those who are named in the situation. But so then you're saying you'd like, what further steps would you like Alberta Health Services to take?
Don't sign any privatization contracts. It's clear that they cannot be trusted, that they care more about trying to push an American-style privatized healthcare model where their friends get rich and everybody else waits at home in pain. That is not acceptable. They need to put a complete pause on any privatization efforts and make sure we can get to the bottom of the CorruptCare scandal.
Hi, Sean with City News. The legislature reconvening next week, what do you think that's going to look like? What is going to be the NDP's strategy for trying to hold the government to account on this issue?
I think all Albertans want answers on this issue. I think that we want to make sure that the health minister, who has some incredibly severe allegations against her, is out of the way, that we can actually move forward with full transparency and having a judicial inquiry. So we're going to be calling for that in the House. We've been calling it outside of the House. Originally, we were fine with her stepping aside and there being all of these investigations, but it's clear that Adriana LaGrange and Danielle Smith do not want Albertans to get to the bottom of this. They want to cover this up, and they want to be able to keep making their friends richer and leave everybody else in pain, paying out of pocket. That's not okay. We are going to be standing up in that legislature, fighting for an accountable government, one that's transparent, one that you can trust, and one that knows that their mandate on healthcare and education is a top priority, as well as affordability. These are the things that Danielle Smith just doesn't care about. She only cares about making her friends and insiders richer, and we are going to absolutely hold her to account for that.
On her radio show this past weekend, the Premier said these investigations could take 4 to 6 months. Does that sound reasonable to you? Does it take that amount of time to have a good investigations done? What do you make of the timeline?
We've seen investigations take far longer than that. We've seen the government find lots of ways to stall on accountability and not give the proper teeth to investigations that they deserve. That's why we're saying call in the judge. Let the courts take this over. Let a judge be the one that requires people to come and testify, requires people to share evidence and information. Let's give them the resources that they need to get to the bottom of this. And that, to me, is the only way you can have any accountability on this, is if you get out of the way and you let people who are independent, who in other jurisdictions we've seen judicial-led inquiries get to the bottom of a variety of scandals, and that's what Albertans deserve here.
Going to go to Zoom now. We have a question from Janet French. Janet, your line should be open.
That you mentioned, we know from an October directive that it's Alberta Health, not Alberta Health Services, that's now in charge of negotiating these contracts with CSFs and procurement. And you pointed out that the Alberta Surgical Group Heritage Valley contract expires in about 2 months. But you're also pointing to, thousands of people waiting for surgery. Can we really afford to halt signing contracts or negotiating contracts when so many people are waiting in pain?
Thanks so much, Janet. What we deserve is an investment in using the healthcare resources that we have, that we know provide the best results in the most efficient way to their fullest capacity. Just look at the Royal Alex downtown. My mom got hip surgery there. They have the capacity, they have the skills. What they don't have is government investment to make sure that they're operating on these types of patients and that they're doing so at their fullest capacity. Many emergency departments close in the afternoon. I know a lot of people who are at home in pain or waiting for cancer surgeries who would be very happy to go in at 2 a.m. tomorrow morning if it meant that they could get their surgeries now and not have to wait longer. So it does require investment to make sure that you're properly staffing these centers. But if the government actually believes in wanting to show accountability and make lives better for patients who are in pain or who are afraid that they're going to die if they don't get their surgeries, they would staff up public hospitals. We also know that there's closed surgical centers in many mid-sized and smaller cities across Alberta. So we have buildings. We need to make sure that the staff are hired and properly compensated to make sure that we can all get the right care in the right place at the right time.
Do you have a follow-up, Janet?
Yeah, so what immediate steps do you think that the government could take to make all procurement more transparent? Well, contracting is on pause or not, we don't really know. Like, what would restore public trust immediately in how the government is signing any procurement contracts?
Firing Adriana LaGrange, she does not have the trust or the public confidence of Albertans, and making sure that we call in a judge to do a proper investigation and come up with recommendations on how we can do this without the type of political interference we've seen, which is focused solely on making rich friends richer, according to the allegations, and Albertans are paying hundreds of millions of dollars out of pocket, again, as alleged in these court filings.
All right, taking one more quick look around here. Seeing nothing, we will wrap it up. That ends our press conference for today. Thank you, everyone.
Thank you all.